Hello friends, let us now learn some important points about the pericarditis. Okay, this pericarditis can be acute pericarditis or chronic pericarditis. If there is acute pericarditis, this can be serofibrinous pericarditis which contains both serous and fibrinous exudate, or it can be hemorrhagic pericarditis where there is blood accumulation, or caseous pericarditis where there is caseous necrosis coming out, or purulent pericarditis where the pericardium is filled with pus. If it is serofibrinous pericarditis, it is associated with rheumatic heart disease which shows bread and butter appearance. Then if it is hemorrhagic pericarditis, it occurs whenever there is trauma or whenever there is metastasis, then it leads to hemorrhagic pericarditis. In caseous pericarditis, it occurs due to tuberculosis, whereas purulent pericarditis, where there is pus accumulation, mainly occurs in purulent infections. Okay, these are the acute pericarditis. In chronic pericarditis, there is something called as chronic pericarditis. There is accumulation of fibrous tissue occurs, leading to constrictive pericarditis. We will learn this constrictive pericarditis better in medicine, right? So this is about the pericarditis. Thank you for watching.